So we did our project on soft picks and proxy brushes.
So the purpose of the soft picks are a tool designed to gain easier access when cleaning interproximal areas. The tool consists of soft bristles placed on a thin wire which allow the tool to fit into these tight spaces. The soft rubber tip also stimulates blood flow and reduces plaque. Many studies have shown that majority of people prefer this tool over regular floss because they are quick, easy, and effective. They also come in many different colors, sizes, shapes for different individual needs.
So, while visiting different stores, the major brands that I found were Gum, Equate, and Life. Um, and then when looking online, I found Oral-B's, but I could only find them online. I couldn't find them in store. So the different price points were at Walmart, a 64 pack of gum soft picks was at $5.97, putting them at about 9 cents each. All of the gum Proxa brushes, ultra tight, tight, and wide, were $5.48 for a pack of 8, putting them at around 69 cents each. And then the Equate brand of soft picks were $4.97 for a pack of 80, costing 6 cents each. At Shoppers, it tend to be a bit more expensive. So the gum soft picks Comfort were $8.49 for a pack of 64, meaning they worked out to 13 cents each. The Life brand Interdental picks cost $5.99 for a pack of 60, working out to about 10 cents each. And then the Life brand Interdental brushes in ultra tight, moderate, and wide were $6.49 for a pack of 10, meaning they cost around 64 cents each. And then on Amazon, I found a 20 pack of Oral-B Precision Clean Interdental brushes for $21.99, which puts each individual brush at about $1.10. So when looking at actual stores, Shoppers was more expensive, but when looking at it all together, the online Oral-B was definitely the most costly.
So comparing the products, so soft picks and proxy brushes both have very many similarities. They are both similar with how they are used between the teeth and around dental appliances. They're both recommended for similar individuals, so people with braces or ortho, crowns and bridges, and implants, and for people who find flossing difficult. Both products are similar in price between $5 to $7, and studies show that soft picks and proxy brushes both reduced plaque, bleeding, and inflammation. And they are both available with longer handles for people who may have poor dexterity and to get into those hard to reach places. And some of the differences are proxy brushes are made with soft filaments similar to toothbrushes, and soft picks have soft rubber tips. And soft picks may be easier to use and cause less gum irritation, and they are perfect for tight contact spaces, whereas proxy brushes are great to use with larger embrasure spaces.
So these are some reviews from people who actually use them. The first one says, I use these every morning after breakfast and when I'm getting ready for bed. Both my dentist and I are so glad. My gums are really healthy. And the next one says, there's a lot of tooth area that a brush doesn't reach. Go-betweens do. Well-made product, very simple to use. Together with my toothbrush, go-betweens let me brush all my tooth surfaces. So they tend to like them and they're able to brush the hard to reach spots in their mouth. There were a lot of good reviews saying that they liked them, how there's a lot of different sizes to fit either in the smaller or larger spaces.
So the parts of the Proxa brush include a flexible neck, which allows for more flexibility when going into small and tight spaces. The bristles are soft, made of nylon material, and are triangle to aid in plaque removal. The handle has a non-slip rubber grip, so it's easier for the handler to move around their mouth. A travel cup is included with the brush to keep the bristles safe and sterile for further use.
And parts of the soft pick, so it's soft rubber tip that fits perfectly into tight contacts between the teeth. And there are many sizes available to fit between different sizes of contact spaces. There's different handles that come in various shapes and sizes for easier grip. So that would include the Gum Soft Picks Advanced and the Comfort Flex. The Comfort Flex soft picks also include a mint flavor to allow individuals to get that fresh feeling after each use. And there's also travel cases included to take on the go for people. And the target audience for soft picks are individuals with good dexterity and individuals who find flossing difficult, and also with people with fixed orthodontic appliances, so like braces or lingual wires. It's perfect for clients with implants, crowns, and bridges, and individuals with gingivitis, bleeding, or inflammation. And the target audience for the Proxibrush is also individuals with good dexterity, individuals who also find flossing difficult or don't like to floss, people with deep pockets, bone loss, and gum recession, people who may have missing teeth or large spaces between the teeth, and individuals with braces, as it's good to use to clean around the bracket.
So here we have two demos. The first one is just one we found online on how to use the Proxibrush around your braces. And then the second one is a demo that I made and uploaded to YouTube just on how to use the soft picks.
With braces, there are a lot more areas where plaque and tartar can accumulate. The Proxibrush is ideal to clean this situation. It efficiently cleans in and around braces since it can conform to different shapes with its conical, flexible bristles. The spaces between the teeth and the braces can be cleaned from the top and from the bottom. With braces, it is recommended that in addition to using the Proxibrush, brushing and flossing are also used regularly. This will prevent cavities around braces.
When you're talking about soft picks and interdental brushes, they're both used pretty much the same way. The only reason you're using an interdental brush is if you have larger open contacts or if you have braces. So to use either of them, you're going to do pretty much the same motion. So what you're going to do is you're going to just slip the brush in between the contact. You can wiggle it back and forth a little bit to help dislodge anything if anything's stuck there, and then you just retract it out and you're good to go. You move on to the next tooth. Same idea. Insert it into the contact area, wiggle it back and forth, and pull it out. Most people will stay away from the anteriors. The anteriors tend to be a little bit too tight to actually fit it in there. Of course, with Dexter, we'll be able to, but on real teeth, it's a little bit harder. And yeah, that's how you use a soft pick or an interdental brush.
So for marketing, most of it's through dentists or dental hygienists. Most offices will give clients a sample or two to try before they go out and buy it on their own. There's also advertisements through commercials, social media posts, and magazines, and also through brand representatives through seminars for educational purposes. And we'll just show you a short commercial that can show some of these aids.
If a patient thinks cleaning between his teeth is a hassle, I show him these. And no more hassle.
Gum brand for healthy gums. Soft picks rubber bristles clean comfortably. Proxibrush cleaners deep clean. #1 dentist hygienist recommended.
Healthy gums matter.
So I researched an article called The Effectiveness of Interdental Brushes, and basically the article goes over studies. So over the past few years, professionals have noticed a massive shift in their clients' mindsets to improve their oral health and have a better understanding of oral hygiene. That being said, individuals are looking for an effective, quick, and convenient tool to use on a daily basis. Companies have created a tool called Proxibrushes. These are effective in plaque removal, easier, user-friendly, and replace floss altogether. Studies show that the majority of the population do not floss every day. Therefore, interdental brushes are just as, or if not more effective, in lower interproximal buildup. Many considerations were involved when creating this product, those being individual manual dexterity, time, and user-friendly, as well as looking at the person's motivational level. A study was completed in comparing both floss and the interdental brush, which showed significant results between the two. Interdental floss removed more interproximal plaque, reducing probing depths as well as bleeding, and decreased overall gum inflammation. A separate study took place in 2021 by the Canadian Journal of Dental Hygiene with a similar method. In this study, the majority of the population preferred the interproximal brush, as well as significant gum health changes were seen within the 4 to 12 week mark. Floss, toothpicks, and interdental brushes were compared. Patients found that the regular floss was was more effective only in flatter areas, toothpicks were not user-friendly, and the interdental brush was most effective due to the increase of surface area the bristles used. The main takeaway from this article concludes that interdental brushes are easier to use, reduce plaque buildup, improve gum health when used consistently, and are more preferred.
And then the second article that was researched was called Interproximal Home Care, Your Guide to Evidence-Based Recommendations. Then in this article, Dentistry IQ is comparing different size, shape, and brand of floss or interproximal brushes to see what's the most effective for their patients. They start out by stating that all patients had different shaped papillae, which then generated the study published in the International Journal of Dental Hygiene. This study took two different shapes of interproximal brushes, one being cylindrical shaped and the other being cone shaped. The results of the study showed that when patients used the cone shaped brushes, plaque and bleeding scores were higher when compared to the baseline at the lingual sites. Therefore, the cylindrical brushes are more effective in reducing the amount of plaque and bleeding since it's not as sharp and it's easier to use. Later in the article, there was a 6-week long study that took place where participants were assigned to one of 4 products: regular floss, Butler flossers, go-between Proxa brushes, and soft picks. It was settled that all the products involved reduce interdental plaque. However, the dental floss in the study was matched in performance by the flossers and the soft picks. Additionally, the go-between cleaners showed a greater reduction in the gingival index score Buckley than the other 3 products.
So our opinion. So as a previous ortho patient, I really enjoyed the soft picks to get around my brackets, especially after meals. My hygienist actually recommended them to me as I was having difficulty reaching certain places. And yeah, I just really liked the way that they helped me clean between my teeth, and it really improved my overall oral health.
And I use the soft picks all the time under my lingual wire. I just find it so much easier than trying to floss underneath it with string floss. I've noticed a big difference, and I would definitely recommend them to everybody because they are so easy to use. And when I had braces a few years ago, I was also given a Proxa brush to clean around my brackets, and I found it great for getting rid of food. And it was simple to use and perfect to keep in my backpack or purse to carry around when I went out in public. And these are just our references.